Hello.
Hi.
How are you doing?
Doing all right. How about yourself?
I'm doing well. My name is Lisa Castleberry. I'm a PA student with Methodist University, and I'm here today to do a cardiovascular and peripheral vascular exam on you. Would you mind confirming who you are with your name and date of birth?
I'm Mace Lowen, and my date of birth is August 21st, 2002.
Excellent. That matches the file, so I'm going to go ahead and wash my hands, and then I'm going to go ahead and proceed with your exam. Okay, now Mace, I'm going to have you do a few maneuvers as we listen and palpate and inspect the cardiovascular system. So I'm going to give you some clear instructions today, but are you okay laying down on the table and sitting back up periodically?
Perfectly able.
Okay, wonderful. All right, so I'm going to start off just noting that you appear to be alert. Do you know where you are?
I'm at the Methodist University H&P lab.
Okay. Do you know what day of the week it is?
It's Wednesday.
Okay, so you are alert to person, place, and time. You appear to have an appropriate affect for the situation. And you also well groomed. Okay, so that takes care of the first part, which is our general survey. I also note that you aren't exhibiting any signs of distress. You don't appear to be short of breath. You don't appear to be clutching your chest. You don't appear to be sweating or lethargic. Okay, and also I did note your vital signs before I came in. Your blood pressure and your heart rate were both normal. Okay, so that's the first part. That's the general survey. Now I'm going to proceed to start inspecting the cardiovascular system. So for this, I'm going to come over and I'm going to lay the table or raise the table to a 30-degree angle, roughly. And then if you would lay back for me, and I'm going to make sure not to forget to extend the leg rest down here. That's very uncomfortable if I were to leave that without support for your legs. And I'm going to start, if you would unbutton that top button for me. We're going to start by taking a look at the great vessels of your neck. So as we look, you can see pulsations usually of the carotid and jugular veins, carotid arteries and jugular veins. But if you shine a light, it helps to be able to see those pulsations. So it does appear that you can see the venous pulsation right here because it kind of has a bimodal peak and then a drop. And that fits with where the veins are. They're kind of an external part of, or the external vein is here kind of behind or beside the some of the neck muscles. And then the carotid arteries, you may not be able to see those pulsing, but those are deeper, and we'll assess those with palpation and auscultation later. But what I'm doing right now is I'm just assessing. I'm actually going to come over to the side of the table for this side of your neck to make sure that the venous system, the jugular veins, both the external and the internal veins, are not distended. Okay, and if they were distended, they would be very engorged, and you would be able to see them run the full length of the neck. But in this case, I don't see that on you. Okay. All right. Okay, so then the next step, and I apologize, I should have had you do this before I had you lay down, but are you able to just sit up for me and then remove your shirt? Okay. And while he's doing that, I'm just going to talk to the camera here and just remind students, if you have a female patient, make sure that you maintain appropriate draping, particularly as you work on one side of the chest. Make sure that they, if you had a gown on, keep the right side covered while you assess the left, and then you would move back, cover the left and assess the right. But Mace, if you'll go ahead and have a seat again for me and lay back. Okay. All right, so the next step is we're going to just take a look at the interior chest wall, similar to the way we did in the pulmonary exam. We want to just take a look and make sure we see symmetry of the thorax, make sure we don't see any scars or injuries that we need to ask about, no surgical scars. Also, let the patient know I'm just going to gently palpate the bony structures of your chest. You let me know if you have any discomfort, and I'm going to try to warm my hands up because they're cold. Okay, so I just follow again the clavicles here, and I would just press in on the sternal body Okay, and then I'll come back and just kind of walk my fingers down the ribs. You doing okay, Mace?
Doing great.
Okay, and just kind of fan out as you get beneath the nipple line there. Okay, no tenderness there. All right, we don't see any deformities of the chest wall either. The next thing I want to do is I want to palpate, make sure you don't have any abnormal vibrations coming from the heart to signal any kind of issue with the way the heart's beating. So for this, I need to put a couple fingers down on your chest and just feel as the heart beats. Okay, and then I'm going to switch and go to the heel of my hand. Okay, and I am roughly over the sternal angle near the second right intercostal space, and this is considered to be the aortic area. And then I move over here to just on the other side of the sternum. Again, put my fingers down to feel, and what we're doing here is we're feeling for something called lifts or heaves. Okay, and then I would shift to the palm to make sure there were no thrills. Okay, again in that aortic area. And then I would move down again the sternum down, and if you need your bearings, make sure you find the sternal notch and you come down about 5 centimeters. This is the sternal angle. You can actually feel your sternal angle very clearly, and just move out. And that little dip off between the ribs, this is the second left and right intercostal space. And so I need to make my way down. This is the third rib. Here's the third intercostal space, fourth rib, fourth intercostal space. So roughly here is where I want to continue to feel again for the lifts or heaves, and then the thrills. And don't say that to your patients, that sounds weird. Okay, just think that inside your head. And then finally come down to just beneath the fifth rib, the fifth intercostal space. And then again, use your clavicle as a landmark and go about halfway your clavicle, and where those two meet, this is roughly where the apex of the heart is. Okay, and so again, we would feel for the lifts or heaves, and then again switch over to the palm for any thrills. Now while I'm here, because this is where the apex of your heart, where the ventricle, the left ventricle is, I need to see if I can feel that as you roll over to your left, as the heart comes closer to the chest wall. So if you wouldn't mind turning to your left while I continue to hold here. Excellent. Okay, you can return back to the bed. Perfect. All right, so that concludes the palpation that we're going to do. Now we're going to move into our auscultation. We want to use those same regions, the aortic, the pulmonic, the tricuspid, and the mitral. And this is basically where if there's a murmur or there's some valvular disease, you're going to be able to hear evidence of those disease in those locations best in those spaces. Okay? All right, so with the stethoscope, again, as a reminder for those of you who have cardiology 3 and 4, you don't have to turn to use bell and diaphragm. You simply need to apply gentle pressure for the diaphragm, and then to activate what you hear with the bell, you just push in a little bit harder. So did I say it backwards? Okay, I'm sorry. Light pressure is the bell, more intense pressure is the diaphragm. I apologize. Okay. All right, so again, for this, I just need you to breathe normal as I listen to these locations. Okay. Press in. Okay. Press in. And we do this because you can hear different frequencies with different pressure. So you can hear the low frequency and the high frequency murmurs if you do it that way. Okay. Okay. Mace, I need one more time for you to roll over to the left side of the bed while I hold the stethoscope in place, allowing me to hear that mitral position in that position. Go ahead and lay back. Thank you very much. And that would accentuate certain types of murmurs that you may hear there. Okay. All right, so that concludes the majority of the heart exam. Now we want to change our focus to the peripheral vascular system. And so for this part, if you would sit forward for me. Okay. And as I've told you guys before, as you get better at this, you can eliminate all this movement by the patient. You can combine techniques and assess different systems in the same region before you move on. But for right now, I'm just trying to demonstrate each exam type, like inspection or palpation or auscultation at one time so you can see the whole thing, okay? So for this part, I'm going to start off by just inspecting the patient, taking a look at the skin, also to make sure that there's no cyanosis, also the mouth, or if you'll say eye forming, just take a look at the mucosa, great. And then I'm also looking here at the color of the hands and the fingers, and then also the nail beds here. Oftentimes if you have cyanosis, those nail beds will be kind of bluish colored. And then if we flip over and just gently pinch the fingers, we want to see a brisk capillary refill here that signals good circulation, okay? And then Mace, if you wouldn't mind removing your socks and shoes, we'll also do that for your toes and your feet. And again, while he's doing that, we also, in general, we just want to assess or inspect the arms for any signs of edema. We typically assess for edema by pressing on the lower extremities, but you do want to just make sure you glance at the arms and make sure they don't look significantly edematous. Okay, thank you. I'm going to grab my stool here, incline to my back. Okay, he'll sit back just a little bit on the table for me. Perfect. I'm just going to roll your pant leg so everybody can see. Okay, so for this part, again, I'm just checking the temperature. If you kind of just touch arms and legs, you can tell if they're warm, that's a good sign. If they're real cold to the touch, you'd want to examine circulation better. But the same thing, you just want to look at the color. You also want to just gently press on the great toes to look for a brisk capillary refill. And then using the bones in the feet and the leg, if you do suspect any swelling, you just want to gently push against the bone, kind of work your way up the foot and the leg to see if there's any dents left behind, which would be a sign of edema. We don't see that here on his feet, okay? This is how you would do it. Now, if you found some edema, you would continue to press on that shin bone all the way up to where it stops, and then you would note that in your documentation of the exam. Okay, thank you. All right, so I believe that's our inspection. So now we're going to auscultate again. Now this part of the exam, I'm going to auscultate the carotid arteries. Honestly, it makes more sense to do this when the patient is laying down, because I'm going to have to lay him back again. So you may want to do this when you do your jugular venous distension. Go ahead and lay back for me. There we go. Please don't forget his leg rest. All right. So for this part, we always with the carotid arteries, you want to listen first before you start pressing on them. And I personally just like to use the smaller diaphragm just because it's a little tighter location. I want to get full contact with the diaphragm here. So Mace, if you'll turn your head to your left for me, you can use the landmarks here. You've got the sternocleidomastoid muscle here. You can see that strap-like muscle here. And then I use kind of the mastoid bone and the sternal notch, and I try not to go in between, like right in the middle, because you've got some important structures in the vasculature, the sinus, carotid sinus, which if you massage that too much, your patient's going to pass out. So I usually, the textbook recommends going a little bit lower, so just kind of above the sternal notch and just medial to the sternocleidomastoid muscle right here. And you can either do, we're going to listen. So now that you have your landmarks, and again, this is roughly where you want to listen, and have the patient take a deep breath in and hold. Okay, listen for a few seconds. Go ahead and breathe out. Very important that you have them hold their breath. If they don't hold their breath, you'll hear their breathing, and that would obscure potentially a bruit in their neck, okay? So I've listened to this side, so Mace, if you'll turn your head towards me, I'm going to come around and do the same thing on the other side. Okay. So again, just my landmarks. I've got where that neck muscle is and where his sternal notch. So roughly in that little angle there, this is a good place to listen. If you'll take a deep breath in for me and hold. Wonderful. Breathe out. Okay. What you want to hear is nothing. You want it to be quiet. If you hear a kind of a whooshing, harsh sound. That could mean that you've got some narrowing in those carotid arteries and the blood's having a hard time getting up to the head, and that's not what we want. Okay, so we've done the auscultation of the carotid arteries, and while we're here and while he's already laid down, I'm going to go ahead and do the palpation. So Mace, again, if you'll turn your head for me to the left, same thing, we just get our landmarks, we get that neck muscle here, the sternal notch, and kind of where that angle is, using 2 fingers, you would push in and hold. Okay, just feel the pulsation, feel the rhythm of it, feel the intensity of it. Wonderful. Also, always check the other side. You want to compare symmetry. And very important, do not palpate both carotids at the same time. If a patient's got some compromised flow to the head, you could cut off blood flow. Don't do that. All right, so again, we've got our landmarks here, that neck muscle, that sternal notch. So again, kind of come to where this angle is, press in and hold. And you may have to put a little pressure on it because that's an artery. It's going to be a little deeper than the veins. Again, if you have trouble feeling it here, go ahead and find kind of that mastoid bone and the neck muscle come just anterior to both structures and push in. You can oftentimes feel it there as well. Perfect, and that feels symmetric to what I saw on the other side. Okay, Maisie, if you want to go ahead and sit back up for me, please. So, that's the carotid. Okay. Now I'm just assessing I'm just looking at our checklist here, make sure I don't miss anything. You doing okay so far?
Doing great.
Important to check on your patient. Okay. All right, the next thing I'm going to do is I'm going to go ahead and proceed to look at the large arteries of the arms. Okay, before I do that, we want to slip in some lymph node assessment. We'll learn more about the lymph nodes in the neck as part of your ear, nose, throat, and neck lecture later this semester. But for right now, we want to keep in mind that lymph nodes drain fluid, excess fluid, and oftentimes filter things out of our body that irritants and infections and things like that from peripheral tissue. So in the arms, the lymph system does have a collection of lymph nodes right here in the medial aspect of the upper arm, right above the elbow, called the epitrochlear lymph nodes. So with the patient's arm like this, with the elbow roughly 90 degrees, you can hold this part with your hand. You can take your fingers and just kind of push in here to make sure none of those lymph nodes are enlarged or tender. Any pain when I do that? Okay. Most lymph nodes are very small. They are pea-like in shape, and oftentimes if they're not swollen, you may not feel anything. That's the key there. You don't want to feel anything. So I would just compare the other side. Again, support his arm, kind of flex that elbow, and just push in right here. Kind of roll your fingers around to see if you feel anything. Okay, that's good. All right. And then the other thing you guys should be familiar with is the brachial artery. We're going to look for that again like we did for your blood pressure check. Remember to come to the antecubital crease, and you've got your bicep muscle. Just medial to the muscle is the brachial artery. And you probably need to push in pretty good. And again, you may need to push the arm back some until you feel the artery. You can switch hands so you get a better angle. Okay, so you want to find that artery and you want to feel this and then go over to the other side. Now you can, if you want to get really good at this, if you're really talented, you can do them both at the same time. I'm not quite that talented, so I just move sides. Okay, and again, very important to compare. We're comparing pulses bilaterally to make sure that they're symmetric, and that did feel just like that side. And then we'll end with the radial artery. So again, radial artery is on the wrist near the thumb side. So you would use the bones of the wrist to push in here. And sure enough, there's his radial artery. And this one is a little easier to do both at the same time. But if you're not ready to do that yet, you can come over and just assess this one alone. Okay. All right, so those are symmetric. That's what you're looking for. And so we've looked at the neck arteries, we've looked at the arteries of the arms. Now we're going to proceed to the arteries of the lower extremity. So for this, Mace, one more time, if you could lay back for me. Okay. We're going to assess the femoral arteries. These are the large arteries, and are you able to just loosen the buckle or the belt? These are the large arteries that come out of the abdomen and down into the leg. Okay, and if you're looking at your patient, roughly where their abdominal cavity meets their leg, where that inguinal line is, the femoral artery and vein are roughly midline, maybe slightly medial, okay, on both sides. And so what you want to do with this is you want to be able to listen again. We want to listen to these arteries first, and then we're going to palpate both the artery and the lymph nodes around them. You've got femoral arteries. I'm going to show you on this side, Mace. If let's say the femoral artery is roughly right here, and Mace, actually, if you would mind just holding, placing your hand over your penis and scrotum and moving them away from me or away from my hand so that I don't accidentally hit you there. So basically, if the femoral artery or vein is right here, you've got a horizontal inguinal lymph node chain that's right here, and you also have an inguinal or kind of a vertical chain that kind of goes around the artery there. So as you're listening, and then after you start palpating, just kind of feel for lymph nodes here, and also kind of wrapped around the arteries as they go into the leg. These are larger. These lymph nodes sometimes you can feel. Again, if there's tenderness, or if one or some of them feel much bigger than the other ones, that's when we have a problem. Okay? All right, so for this, Mace, we're, again, just to protect privacy, we're not going to remove any clothing, but basically what I would do if you had a patient is make sure you're skin-to-skin contact with the stethoscope here, but roughly you want to press in and listen, see if you can hear the femoral artery. And remember, if everything's normal, you shouldn't hear anything. You shouldn't hear any bruits. Okay, and I'm going to do the same thing on this side. Okay, thank you for assisting. Okay, good. So those are nice and quiet. I don't hear any bruits, so I'm going to go ahead and start palpating. And I'll put that on my neck like I told you guys to do. All right, I'm going to go on this side first, okay? All right, so I'm going to press in. And again, the femoral arteries can be somewhat deep, so you may need to kind of put some pressure on it. You may even need the help of the patient. You may ask the patient if you're not able to feel it. Is this where it is? Can you feel anything pulsing there? So again, if you notice midline, but just a little medial, this is your best bet right here. And I'm gonna be honest, I can't really feel anything through his clothing, but my estimate is that his femoral artery is roughly right there, okay? And so then I would just kind of do a palpation of the lymph nodes along that horizontal line there, and then I would just come down and feel the lymph nodes around the artery and vein in this part of his leg. Okay, we're going to switch sides, Mace. Okay, same thing. I'm going to estimate again about midline of this inguinal area here, and just go a little medial and press in. See if I can feel the artery. Okay, and again we want to compare, make sure it feels about the same as it did on the other side, and then feel the horizontal lymph nodes. Okay, roughly right in here. And then again, the lymph nodes as they come down the leg, kind of wrapped around those arteries and veins. Okay? Thank you. We'll go ahead and sit up. And then we're going to continue down the leg. We're going to go down to the ankles and feet. And so I start off with the posterior tibialis. I believe I said that correctly. That's going to be, if the patient's in front of you, it's going to be on the inside or medial aspect of their ankle. And if you find the medial malleolus, it's a great landmark. You just go right behind it and push in, and usually you can feel the artery right there. Sure enough, his is very strong, okay? And the same thing, I would go ahead and just compare, find the medial malleolus on this ankle, push in, and sure enough, there it is, nice and strong, okay? And then for the feet, what you want to do for the dorsalis pedis, which is the artery that's on the top of the foot, find the great toe, and then this extensor ligament right here that allows the toe to do this. What you want to do is you just want to come in just a little lateral from that. You want to go towards the outside of his foot. And if you don't feel it right away, you can kind of work your fingers down, or you go a little bit more lateral. Okay, there's his right there. Okay, and then I want to compare that again to the other side. Again, just find that ligament there for the great toe. Just go a little lateral, and sure enough, I hit this one right off. Okay, just compare, and they are symmetric. Okay, and I do believe that concludes our exam. So Mace, thank you so much. Do you have any questions or concerns at this point?
Not at all.
Okay, well, thank you for coming in and allowing me to do that exam.
Thank you.
Okay, thanks. All right.
Thanks.